Recognizing stroke, explaining the FAST test, saving lives in the golden hour. Welcome everyone to the US Health Guide channel. Today we're going to explore a critically important topic that could save your life or the life of a loved one. How to recognize a stroke using the FAST test. Stroke, also known as a cerebrovascular accident, is a silent enemy that can claim a life or leave severe disabilities in an instant. But the good news is, if we know how to identify it early, we can completely change the outcome. Let's dive in. So what exactly is a stroke? Simply put, a stroke occurs when the blood flow to a part of the brain is suddenly interrupted or significantly reduced. When this happens, brain cells are severely deprived of oxygen and nutrients, and within minutes, they begin to die if blood supply isn't restored promptly. There are two main types of stroke. Ischemic stroke, which accounts for the majority of cases, about 85%, happens when a blood clot or plaque blocks an artery, obstructing blood flow to the brain. The second type is hemorrhagic stroke, less common, about 15%, which occurs when a blood vessel in the brain ruptures, causing bleeding. Crucially, don't overlook a transient ischemic attack, TIA, often called a mini-stroke. TIA symptoms are identical to a stroke, but last for a very short time, usually less than 24 hours. However, a TIA is an extremely important warning sign, indicating a high risk that a full-blown stroke could occur at any time afterward. Stroke is the third leading cause of death and the primary cause of disability globally. The consequences can be severe: limb paralysis, facial drooping, speech loss, vision problems, difficulty swallowing, and much more. What's concerning is that stroke is increasingly affecting younger individuals, no longer just an ailment of the elderly. In stroke emergencies, there's a paramount concept, the golden hour. This is the critical time frame from the onset of stroke symptoms until the patient receives specialized medical intervention. For ischemic stroke, treatment with clot-dissolving drugs should be administered within the first 4.5 hours, and endovascular intervention can extend up to 6 hours, or even 24 hours in some specific cases. For hemorrhagic stroke, emergency care is needed as soon as possible, ideally within the first 3 hours. Why is time so crucial? Because it's a race against the clock to protect every brain cell. Studies show that for every minute of delayed emergency care, an estimated 2 million brain cells of the patient die permanently. The sooner emergency care is provided, the higher the survival rate, the less severe the brain damage, and the greater the chance of recovery. Unfortunately, many patients still miss this golden hour. The main reason is a lack of public awareness. Patients or their family members often fail to recognize stroke symptoms, mistaking them for common conditions like a cold or trung yaw, a traditional belief of being affected by wind, and resort to incorrect first aid methods such as applying oil, coin rubbing, or acupressure. These actions are not only ineffective, but also severely delay access to professional medical treatment, leading to regrettable consequences. To address this, global health organizations have recommended a simple, easy-to-remember rule: FAST. Applying FAST empowers individuals to be the first to detect and act, thereby increasing the likelihood of timely emergency care, minimizing brain damage, and reducing post-stroke complications. Let's learn about each letter in FAST. F stands for face. Ask the person to smile or show their teeth. Observe carefully if their smile is distorted, if one side of their face is drooping, or if their philtrum, the vertical groove between the base of the nose and the border of the upper lip, is asymmetrical. This is a very clear sign of nerve damage affecting facial muscles. A stands for arms. Ask the person to raise both arms above their head at the same time and hold them for a few seconds. If one arm cannot be lifted, is weaker, or drifts downward, it's a worrying sign. S stands for speech. Ask the person to repeat a simple, clear sentence. For example, "Today the weather is beautiful." If they cannot speak clearly, slur their words, speak unintelligibly, or cannot repeat the sentence, this could be a sign of stroke. They may also have difficulty finding words or understanding what others are saying. T stands for time. The letter T is not a symptom, but a reminder of the urgency of time. Whenever you detect even one of the FAS signs mentioned above, no matter how fleeting or if it disappears, call emergency services immediately. Remember, time is brain. Beyond the FAST rule, stroke can manifest with many other symptoms, especially in cases involving the posterior brain regions. Extended rules like be fast, balance, eyes, or faster are used to include these additional symptoms. Specifically, B, balance, refers to sudden loss of balance, severe dizziness, a feeling of unsteadiness, difficulty walking, or impaired coordination. E, eyes, refers to sudden vision loss, blurred vision, double vision, or loss of vision in one or both eyes. Other common signs include sudden and severe headache, particularly common in hemorrhagic stroke, though not all stroke cases present with this symptom. Numbness or weakness in a part of the body, which can appear in any part of the body, not just the arms, but also the legs or face. Difficulty swallowing, feeling as if something is stuck in the throat, or inability to swallow food. Cognitive impairment, confusion, difficulty communicating, disorientation, or unawareness of surroundings. Stroke can even occur during sleep, known as wake-up stroke, accounting for about 14% of all stroke cases. When any stroke sign is detected, swift and correct action is crucial to save the patient's life and minimize sequelae. Step 1. Call emergency 911 immediately. This is the most important and top priority action. Do not hesitate, not even for a minute. When calling emergency services, provide clear and accurate information, the patient's name, age, and gender if known, the exact address where the patient is located, a brief and precise description of the symptoms occurring, especially the fast signs observed, the exact time the symptoms began, as accurately as possible, and any underlying medical conditions or medications the patient is currently taking, if any. Throughout the process, remain calm and follow all instructions from the emergency operator. Step 2. Administer proper first aid while waiting for the ambulance. The goal of on-site first aid is to ensure the patient's safety, maintain basic vital functions, and prevent complications while waiting for professional medical personnel to arrive. What you should do: help the patient lie down safely, placing them on their side with their head slightly elevated, about 30 to 45 degrees. This position helps prevent falls, injuries if the patient loses balance or consciousness, and, more importantly, prevents aspiration if the patient vomits. Loosen clothing, remove or loosen ties, scarves, belts, and tight clothing to help the patient breathe more easily. Check breathing and circulation. Observe if the patient is breathing normally. If they have difficulty breathing, loosen clothing. If they stop breathing, perform artificial respiration. If they have cardiac arrest, perform external chest compressions. Clear the airway by wrapping a clean handkerchief or cloth around your index finger to gently remove any saliva, phlegm, or leftover food from the patient's mouth. Remove dentures, if any, to prevent choking. Keep the patient warm by covering them with a blanket or jacket, especially in cold weather. Record information noting the exact time symptoms were first observed and any abnormal manifestations to provide to the doctors upon their arrival. This information is crucial for diagnosis and treatment planning. Reassure the patient by remaining calm and speaking gently to help them reduce anxiety and cooperate. What you absolutely should not do: avoid moving the patient by motorcycle or non-specialized vehicles, as this can worsen their condition. Only move them by ambulance or car under the guidance of medical personnel. Do not give them food, drink, or any medication, including blood pressure medication. This can cause choking, airway obstruction, or make the patient's condition more dangerous and difficult to control, especially before the type of stroke is determined. Do not use needles to prick the 10 fingertips or toes, or perform coin rubbing or acupressure. These methods have no scientific basis, are not helpful, and waste precious golden hour time, causing injury, infection, and delaying proper emergency care. Do not put anything in the patient's mouth if they are having a seizure. This can cause dental or jaw injuries or severe airway obstruction. Stroke is a medical emergency that can claim lives or leave severe disabilities in an instant. However, the ability to change this outcome lies in each individual's hands through quick recognition of critical signs. The simple FAST rule, face, arms, speech, and time, act immediately, is an effective tool for early detection and timely action. The core message to always remember is time is brain. Every minute of timely emergency care is an opportunity to save a life and preserve brain function, minimizing sequelae. This understanding extends beyond personal awareness to become a community responsibility. Therefore, a strong call to action is issued. Don't keep this knowledge to yourself. Share information about stroke and the FAST rule with your family, friends, colleagues, and the entire community. The more people who know, the more lives can be saved. In addition to timely recognition and emergency care, proactive prevention plays a crucial role. Take the initiative to get regular stroke screenings, especially if you have high risk factors such as age, over 55, a history of conditions like high blood pressure, diabetes, high cholesterol, heart disease, or an inactive lifestyle, frequent alcohol consumption, or smoking. This helps detect risk factors early and allows for timely intervention, preventing stroke from occurring. Be a part of the solution. Let's work together to raise stroke awareness to protect our own health and the health of those around us. Thank you for watching. Don't forget to like, share, and subscribe to our channel so you don't miss out on other useful information.